Hi, Dr. Johnson.
How you doing?
I'm doing okay.
Yeah?
Yeah.
Good to see you.
Good to see you too.
Yeah, how's it been going?
Things are good. Still having a little bit trouble with the sleeping. Yeah, like I think, but things are good. You know, like the chronic pain is not as bad as I thought it would be.
Oh, I'm so glad to hear that.
Yeah.
Yeah, why do you think that is?
I think I've been trying to notice more, like when I'm like have some tension.
Yeah.
I try to like just relax or like. I go to the bathroom a lot now, so every time I go to the bathroom, I just kind of notice.
Oh yeah.
So I kind of like built in a little reminder.
Yeah, that's really brilliant actually. If we're trying to do a behavior, it's so much more likely to happen if we have a prompt. So like going to the bathroom is built in, so that's perfect. You can pick other times in the day too, like when you turn on the kettle or you turn on the shower. There's infinite ones.
Yeah.
So that's really smart that you did that.
Cool. Okay.
I'm glad that's working for you.
Yeah.
Your vital signs and your weight look good. Are you feeling your baby move?
A little bit.
Yeah.
Yeah, like on the bottom area.
Yeah.
Mm-hmm.
Yeah.
Yeah.
That's really cool.
It is really cool. Yeah. Like it's like I finally like feel like it has a personality.
Yeah. Yeah, exactly. You're starting to get to know your baby.
Yeah.
You probably notice like different patterns in its movement and things like that. Even.
Yeah, I notice like the baby moves after I eat. Yeah. Spicy or sweet, like it moves more.
Yeah, that's really cool. Noticing, actually, that's like a parenting skill that you're developing. Noticing the baby's routines is something that you can use to kind of, even when you're taking care of them outside. So that's cool. Yeah.
Okay.
Good. Let's see, you filled out the depression screener, the Edinburgh, and that looks like it's been pretty stable. It looks like from your answers, things have been going okay mood-wise. Would you agree with that? Yeah. Okay. Good. And then last time we had talked some about your back pain. It sounds like it's going okay.
Yeah, the back pain's not as bad as I thought it would be. But there, the questions you gave me last time, it just made me kind of worried that, like, I would pass on the stress that I have to my baby. So I don't know what to do about that.
Yeah. Oh, thank you for saying that. I think that's such a common concern among every pregnant person because we think we need to be sort of perfect, the perfect mom, right? No, I don't think that that's something that you need to worry that you need to control. You're already doing so many things to take good care of your baby, right? Including taking care of yourself. And then stress is just part of human existence from the beginning of humankind, right? So having stressful events and then recovering from them is part of that. And you are there to help your baby do that. So babies actually can perceive and understand our support. And so whatever happens for your baby, you can show your attention and concern, and babies respond to that. And that combination, actually, the distress that the baby has when they're crying and then soothing by their parent, that is like a little mini stress and resolution cycle. And that's actually what builds this amazing relationship, or the amazing relationship between parent and child. That's actually a buffer for whatever stress befalls the baby later on in life. So just your presence is actually a buffer for your baby against future stress.
Okay.
Please, share further thoughts about that. And if it's something that's concerning you more deeply, we can address it in a deeper way too.
Yeah, I just want to make sure nothing happens to the baby. Last time you asked me about like these things like in early life, and I'm like, gotta make sure those things don't happen either. But
Yeah, well, I think we can't. So your intention is meaningful. We can't control everything that happens, but it's also important to know that even when bad things do happen, health outcomes or other outcomes aren't inevitable. And in fact, there's a lot we can do that buffers and supports people so that they don't experience negative consequences, or that they can handle whatever comes up. The relationship that we were just talking about, that you're already starting to develop because you're noticing your baby's patterns, right? Just your ability to respond to your baby is a huge buffer against anything that happens to him.
Okay.
And he has you as a protector.
Yeah.
And your partner, you've talked so much about that strong relationship and your family. You have this whole web of support that'll be helping. Mm-hmm. Does that help?
Yeah, that helps.
You mentioned also you were maybe going to go for more walks in nature with a friend.
Yeah, I really wanted to do that. I started, but then my feet got really swollen.
Oh, okay.
And so I'm finding that it's hard to like actually walk. But it was helping. Being in nature was helping.
Oh, okay.
I could tell it was helping my pain. But now, like with my swollen feet, it's hard.
Oh, okay, yeah. Swollen feet is really common, as you know. I'm looking at your blood pressure is totally normal, so I'm not worried about preeclampsia, and your urine studies are normal and things. So I think that it's probably kind of normal pregnancy swelling, most likely. Have you tried compression stockings?
No.
No, okay. You could try those. Have you noticed when you put your feet up, it gets better?
It does, yeah.
Yeah.
I noticed that.
Okay. So it sounds like kind of pregnancy-related swelling. The compression stockings may help. And then it's also like with exercise in pregnancy, it's really kind of a matter of checking in and just kind of going with the flow of the changes in your body. So you might not be able to go for like an hour and a half long hike.
Yeah.
You might need to do kind of a few 10-minute walks a day. Does that sound?
Yeah, that sounds, I'm going to try the compression stockings.
Okay.
And then ask my friend to do like, we could do like a short walk and then elevate my leg on the bench or something in the park.
That sounds good. Yeah. And I'll make sure, we let you know on the way out kind of the warning signs for all of the unusual stuff, but this really sounds pretty classic.
Okay.
Yeah.
Good.
Yeah. Good. Okay. Anything else we can take care of today?
No, I think that's it.
Okay.
Thank you so much.
That looks good. Yeah, good to see you.
Good to see you
Okay,
too.
we'll see you next time.
Thank
you. All
you.
right, bye, Sarah.